Progress.
So, good morning, everyone. My name is Sarah Robbins. I'm the Senior Policy Manager here at the Seattle-King County Coalition on Homelessness. And welcome to the second training in our Public Benefits Are Key series. Our first training last month focused on the aged, blind, or disabled and housing and essential needs. Programs, and this training, as you know, is focused on TANF and WorkFirst. So this is a training series that we are putting on in conjunction and partnership with Solid Grounds Benefits Legal Assistance and also with the REACH outreach team. So just for a little context on the coalition, I'm going to start off with our mission statement. So our mission is we mobilize our community to challenge systemic causes of homelessness and advocate for housing justice. And within that, we have a strongly believe that access to public benefits for folks that are experiencing homelessness, especially those living in unsheltered homelessness, is a key to getting people housed. So this morning we are joined by Hannah Rosenberger, who is a staff attorney and the interim program manager at Solid Grounds Benefits Legal Assistance. She is going to be doing the majority of the training this morning, with myself doing some small parts of it. So I will hand things over. So we are recording. You won't be on the recording unless you come off mute. And we will be the next series or the next training in this series next month in July will be focused on Medicaid and the intersections of Medicaid and Medicare. So if you ever have had questions about how to get your clients on Medicaid, if the clients are already on Medicaid, how to get certain things paid for, prescriptions, services, if you're working with clients who might have a Medicaid spend down, and how to get them services with that Medicaid spend down. I know particularly behavioral health services can be challenging. That is the training for you to come to, and we'll put that link for the registration in the chat. And then also after at the end of this training, we do have a post survey that we would love for everyone to fill out to give us feedback. This is a series, so we will repeat. And so we would love to have feedback on what worked really well, what was helpful, did we miss anything for when we do this again. So I will hand it over to Hannah.
Great, thank you. I'm going to share my screen with you all. Just a moment. All right, so let me just get into. Sarah, can you nod if you can see my screen? Okay, great. Well, hi everyone. Thank you so much for joining us today. Again, my name is Hannah Rosenberger, and I am with the Benefits Legal Assistance Program out of Solid Ground. Solid Ground is located, or our headquarters are in Seattle, but we provide free legal services to individuals and families throughout King County. And we work on public benefit issues. So things like TANF, which we're talking about today, food assistance, Medicaid, ABD and HEN, just for our short list of what we help folks with. And I will provide all of our contact and referral information at the end of the presentation. So you'll have that information. So, and actually I realized let me minimize this so everyone can see. Before we get started, I wanted to acknowledge, name, recognize that the public benefit laws and policies that we operate within are steeped in systemic racism, and the systems the programs themselves can be systems of oppression. So we won't be talking much more about this for this presentation, but we did want to at least mention it and recognize it. And there are some links here for some good articles and reading if anyone does want to learn more about the context. And another thing that we're always aware of is just the impact of casual racism or using stereotypes when speaking about recipients of public benefits. Especially today, we'll be talking about the work requirements from WorkFirst, which you can see how those policies are, like we mentioned, steeped in racism and systems of oppression. So again, just some additional links here if anyone wants to read more about that. All right, so the topics that will be covered today, I have this list here. At the end of each section, I will pause for questions. So if you have questions, you can type them in the chat, and then our partners at the coalition will read them out loud during the question section. So you don't have to worry about monitoring the chat to make sure you don't miss anything. We'll read all those questions out aloud. So I'll leave that agenda there just for a few more minutes or moments so you can see what we'll be talking about today. Okay, so I will get into the meat of our presentation today. So we're going to be talking about temporary assistance for needy family, TANF. And what that is, it's a cash assistance program that's available to low-income families. Eligibility is based on a variety of things, but mostly gross income, family size, resource, and there are citizenship requirements. The benefit is available for a 60-month or a 5-year limit it's a lifetime limit. There are some exceptions that we're going to talk about today, exceptions and extensions. Individuals are generally required to participate in WorkFirst, which is a path to employment program. And again, there are exceptions, which we'll also talk about today. Clients must follow an individual responsibility plan or an IRP. And just a note that parenting or pregnant teens may be eligible for TANF if they're in an approved living arrangement. So there are some specific rules for teens. And if anyone has a question about that or a specific example, we can talk one-on-one or you can drop a question in the chat. So like I said, and what's the case with most public benefit programs, there are income qualification requirements. So just to note, the payment standard, that means the benefit amount. So you can see in this chart, this is the benefit amount that a family would be able to get. This is the maximum dollar amount that they're going to get based on their family size. And if you're not sure if someone's eligible for TANF, a good rule of thumb is that the family's countable income must be less than the benefit for their household size. So if you have a family of 2, maybe an adult and 1 child, and the parent is getting $900 on Social Security disability, for example, you can look, the benefit amount for a family of 2 is $528. So that family is going to be over the income and not eligible for the benefits. And then how benefits are actually calculated is it's this payment standard minus the countable income, and then the difference is the benefit amount that the family will receive. So again, a family of 2 that has 0 income is going to get $528 per month. And again, if you're not sure if your clients are eligible for TANF or any other program, you can go to washingtonconnections.org and there's a little kind of a quiz, see if I qualify. You type in information about the client and then it'll list all the programs that they might be eligible for and then how to apply. And I'm sorry, I have a little bit of a sore throat today, so I'll try not to cough too much on everybody. So as I mentioned, there are income and resource limits, and different income is treated differently. So if you see the chart on the right, or at least my right, the way I'm looking at it, this is the earned income limit. So if somebody is actually working and their income is coming from employment, so we call that earned income, you can actually divide that amount you make by 50% and compare that to the income limit chart to see if you're eligible. So I mentioned that the benefit amount for a family of 2 is $528. That times 2 is $1,056. So that's why the earned income limits are actually higher than the payment standard. But if your income is unearned, so that means income from maybe something like unemployment, Social Security, child support, then it is dollar for dollar, and the income must be less than the payment standard, the chart that we just looked at. There are resource requirements. So you have to have less than $6,000 in liquid resources, which could be, cash, savings, checkings, mutual funds, and you are allowed to have a vehicle that's worth up to $10,000. And one question you may be asking is, well, whose income counts, in the household? Generally, it's going to be the parent or parents, if they're living together, of the child that's applying, or children that they're applying for. Child support is considered an income. Just to note, if a child is getting SSI, supplemental security income, that's not going to count towards the household income limit, but also that child is not going to be eligible to be part of the grant. So if there are other children in the household and a parent in the household, they can be eligible for TANF, but the child that's getting SSI is not going to be included in the grant. And if the child is working, their income is not counted if the child is in school and maintaining certain attendance requirements. So if you have a specific question about, the makeup of a family, that might be a question that you want to email us directly. There are some other eligibility requirements for TANF. There are immigration requirements. TANF is federally funded, so there are certain immigration requirements people do have to meet. But if there's a family member, a child or an adult that would not be eligible for TANF because of income requirements only, they may be eligible for state family assistance program, which is basically the state-funded version of TANF. Now, if there's a parent that doesn't have immigration status at all, they may still be able to apply for a child-only grant. So again, if you're dealing with a family that maybe has different immigration statuses and you're not sure if they're eligible, reach out to us or to DSHS directly. You do have to be a Washington state resident and responsible for the care of the children, or you may be pregnant and then also eligible. And then just to note, if you're caring for a relative's child, you're a legal guardian, or you're acting in the place of a parent, you may be eligible for that child-only benefit that I mentioned. So I'll just briefly mention this child-only TANF grant again. Again, if you're a person who's caring for a relative's child, or you're acting in place of a parent, or you're the legal guardian, or if the parent is ineligible for TANF for another reason other than income, they can apply for this child-only TANF grant. And then this is just a list of the specific degree of relatives that can apply for this grant. And if I'm speaking too quickly, please let me know. So another requirement for receiving TANF is cooperation with the Division of Child Support. So what this means is if you don't already have a child support in order, DSHS will refer you, in your case, to the Division of Child Support to help you set up a child support order. And just to note, if somebody is receiving TANF but not getting child support, when they start receiving child support down the road, their child support might be reduced to repay the state for the TANF received. And if anyone has questions about, you may have heard of like the child support pass-through, feel free to, there's some specific rules around that. So, put a question in the chat or you can contact us afterwards. So I also want to make a really important distinction. There is something called a good cause exception. So if a client or, an individual, if cooperating and trying to get child support from the other parent would result in serious physical or emotional harm to you or the child in your care, so this might be like a domestic violence situation, they can ask for a good cause exception to not cooperate with Division of Child Support. And this means their case will not be referred to Division of Child Support, and there won't be any effort to set up a child support payment. So if this is a concern at all, definitely bring it up during the application process, to ensure that the client is safe. So I also mentioned at the beginning, there is a 60-month or a 5-year time limit on receiving TANF or state family assistance. And this is a lifetime limit, but there are some exemptions and extensions, So some exemptions, which means you don't have the lifetime limit, are if you're an older needy caretaker, if you're caring for an adult relative with disabilities, caring for a child with special needs, or you are an adult with severe or chronic disabilities. Now, if you don't fit into any of those exemptions, you may be able to qualify for a hardship extension. And there's the list there. I won't go too much into these extensions right now because currently everybody is actually eligible for a COVID-19 hardship extension, which means all TANF recipients should be and will be receiving a time limit extension through June 2023. So if you are seeing clients who are being terminated, if they reach 60 months, let us know that should not be happening. And if someone was terminated from TANF even before the pandemic because they met their 60-month time limit, they can reapply and be eligible under these COVID emergency rules. So I wanted to just, as we're nearing the end of this section, give some tips, practical tips for the application process. First of all, if a family that you're working with is unhoused, make sure it is clear on the application, especially if they're using someone else's physical address, so it might look like they are housed. So what I like to do is if you're doing, you're applying online or there's a paper application, in the line where it says residential address, I will write homeless or unhoused, and then include their mailing address in the line for mailing address. And the reason why it's important to do this is because there are certain exceptions and extensions and special rules for people who are unhoused. Also, if possible, if you can provide proof of income with the application or be getting it ready to submit it shortly thereafter, that can avoid delays when DSHS sometimes has to wait for proof of income. If you have a client who just lost their job or just stopped working, they might have to prove that they actually have stopped working. So sometimes DSHS will ask for this stop work form. So if you think that might be happening with your client and you can get that filled out and just submit it with the application, that can avoid delay. And lastly, I really want to emphasize that advocates, case managers, can go with clients to TANF and WorkFirst meetings. They can be on the phone, they can help them, go into the offices. As long as the client gives permission, advocates can be with their clients. And it's a really good opportunity to advocate for the client with the person that's actually making the decisions. So I'll pause there and see if there are any questions, or I'll see if there were questions, if Sarah or Jody, you can read them out, and I'm happy to answer them.
Yeah, there was one question in the chat. Would a terminal cancer diagnosis be considered a disability for the 60-month time limit?
I will say very likely yes. Let me just go back to, so an adult with severe and chronic disabilities. I haven't had that specific example, so I haven't read, the specific rules, but my first instinct is yes. And if for some reason DSHS doesn't agree, that would be a decision that I would appeal, or if you're working with a client and need to get in contact with us. I don't know, Sarah, if you've maybe had a different experience.
Yeah, I mean, I can speak a little bit to this. So the severe and chronic disability exemption requires that the person provides medical documentation to DSHS to show, basically, they have specific criteria for severe and chronic. So it's something that has to prevent someone from being able to participate in WorkFirst activities, and it has to last at least 12 months. So Most likely, yes, the person would take, there's a form they would take to their doctor to fill out. And they don't have to show it to the level of someone applying for other disability related benefits, but there does have to be medical documentation. So there's another question in the chat. Is a domestic violence victim exempt from participating in WorkFirst?
That's a great question. So I might pause on responding that because we're actually going to get into WorkFirst next. And I have some specific information about exemptions in WorkFirst activities, specifically for survivors of domestic violence. So if it's okay, I'll pause on answering that question and get to it in the next section. And if I don't fully answer the question, we'll have another pause for questions and I can answer it more then. Okay, there are no other questions. I will move us into our next section. We did a good introduction already. Let me just pause my video because it distracts me. So we are going to talk about the WorkFirst program. So I mentioned this briefly. TANF recipients, they are required to participate in WorkFirst. And generally what that means is they are searching for and maintaining employment or engaging in other community services that will lead to employment. So most TANF recipients are required to participate in employment, job search, maybe education or job training program. Clients do sign what's called an individual responsibility plan or an IRP, which outlines these requirements. They must attend a WorkFirst orientation, but on the positive part, not that these other options are not positive, but what I should say is WorkFirst families can receive a variety of support services to help them overcome barriers to employment, and those can be really helpful services. And just some examples of work activities, it might be that someone has to participate in a job search for 12 weeks, or they have to, if they're working part-time, still look for full-time work, or accept a job if they're offered one, or if they are in high school or 16 or 17 years old, they have to continue in high school or engage in a similar education program. So there are some specific exemptions from WorkFirst, and this category means that you won't even be referred to a WorkFirst case manager. So you're exempt from participating in WorkFirst. So if you have a child under 1 year old, if you're 55 or older and taking care of someone else's child, you have a severe and chronic disability, you care for a special needs child, or you care for a relative with a disability. And like Sarah mentioned, you would need to provide some kind of documentation or a letter from a doctor saying that you can't be away from that child or the relative for more than 10 hours a week. And I just wanted to note that WorkFirst participation, the requirements, they were suspended during the bulk of COVID-19 pandemic, but they have been reinstated. So if somebody is required to participate in WorkFirst, those requirements have been reinstated. So I mentioned the individual responsibility plan, or the IRP. It's essentially a contract that says what work you must do, or what you must do to work, look for work, or get ready to look for work. It will also list the support services to help you get a job. And if you don't do an activity in your IRP, you may be sanctioned, which means DSHS will reduce your benefit, as if you had failed to take part in the job search or do something else in your IRP. And I really want to stress that IRPs they're like a contract between the client and DSHS. And contracts can be negotiated and must be agreed upon by both parties. So clients don't just have to accept what DSHS offers. It should be an agreement, and the client should absolutely be part of deciding what should be in the IRP. And clients and case managers must sign the IRP when it's first written, and anytime it gets changed, it should be in the client's primary language. And I would suggest that the client or the case manager or advocate keep a signed copy with other important papers. And the IRP, I have an example, so I'll show you in a few slides, but it will actually list the specific activities, like apply for 2 jobs a month, or take a resume class and then apply for 2 jobs per month. So it can be pretty specific. And generally speaking, the first step in following the IRP is attending the WorkFirst orientation and then doing a job search process, unless someone is exempt for another reason. And just a tip, again, I'm going to say this several times, but advocates can attend WorkFirst meetings. They can help clients advocate for a reasonable IRP that they can actually follow and be successful in following. So part of the process to get an IRP is this comprehensive evaluation. So it's essentially a time when the caseworker or the DSHS caseworker will talk with the client about their background, their work background, experiences, why they're not working and what might help them be able to work. And this is when the DSHS worker might assign specific services and activities that they think will help the participant become employable. So this is, a resume writing class, ESL languages. And again, I just want to say the client should be a participant in this discussion. So, and I've seen this too, if you're talking with a client and they don't know why something is in their IRP or they don't remember agreeing to it, help the client contact DSHS and ask for a review of the IRP so that you can make edits and updates so that you avoid maybe a sanction process down the road. So this is just an example of an IRP. Hopefully you all can see it. So there's just a lot of boilerplate language, but where those big blue arrows are, that is where the specifics for this individual are going to be listed. So if you can't read it, it says do 3 work searches per week, complete a resume after attending a resume writing class, participate in job training, and apply for 2 jobs per week. So this is just a sample IRP. This is the second page of the IRP form, and this includes the work support services. So we are going to have a section about that, but just at a high level, this means DSHS can help pay for things like car repairs, licensing, gas cards, mileage, bus passes. And I'm just going to give a brief overview of these support services because they're really valuable. And then I'm going to hand it over to Sarah with the coalition to share more about her experience with these cases. So just very briefly, WorkFirst participants, they can get support services to help them comply with the IRP and find employment. This list here is not exhaustive, just a sample, but generally the goal of the support services is to help the individual participate in WorkFirst services that leads to independence, or to help you participate in job search, accept a job, keep working, or advance or increase your wages. So if there is something that you think would help your client, reach those goals, and it's not on this list, you can still ask for it. And if something that you're asking for is being denied or DSHS isn't agreeing with it, reach out to us and we can help advocate for that. So I'm going to hand it over to Sarah so she can share a little bit more on the slide.
Yeah, hi everybody. So I think this is a really important part of how you all as direct service providers can help clients get the support services that they need to either do their work or move towards work and education. So on the right hand side of this slide, and we will be sharing these slides with everyone after the training, that link to the support services directory. Actually, Hannah, can you? Yeah,
I'm just going to click on it.
Great. So this is a really amazing resource for both advocates, but also for TANF recipients. So this is DSHS's internal directory of what DSHS can pay for with support services, how much they can pay for, both per item. So for example, if someone needs computer equipment to be able to do work, or for safety reasons necessary to participate in WorkFirst, DSHS can pay up to $500 to help clients get computer equipment. And so what I found is that sharing this with your client when they are, struggling to get certain things that they need, look in this directory. Is it there? Is it something that DSHS is, outlined to pay for? And I've actually had clients take this into their, DSHS caseworker and say, look, this is what, your directory says this can be paid for. Why am I not getting this particular type of service? There are limits on how much DSHS will pay for certain items, which is not fully set in stone. There are processes to do exceptions to rule, which can sometimes be depends on, that's definitely a time where I would get one of the attorneys at Benefits Legal Assistance probably to help. There are also certain limits per year on how much someone can, how much DSHS will pay for these support services. But this is a really helpful resource, both for advocates and for sharing directly with your clients that are receiving TANF. I also want to say that this past legislative session, additional money was allocated in the budget for support services directly for clients to get help with rent and utilities. And that money has now is now starting to come into DSHS from the legislature. So I highly, highly encourage, if you have clients that are receiving TANF and they are having difficulty paying their rent or their utilities, refer them to DSHS to ask for rent and utilities support services. We will also share some additional information in writing from DSHS about this this new part of the benefit related to the pandemic, so you have a little bit more information. But right now, DSHS has a lot of resources to be able to help clients participating in WorkFirst with rent and utilities, and clients should most definitely take advantage of that. And I think that's the pieces that I wanted to cover. I will hand it back to Hannah.
Great, thanks, Sarah. So another plug, my 2 big tips. If you can go to meetings with your clients and make sure they're getting support services. Because I've definitely also worked with clients who didn't know that this was an option for them. And it might be, it's kind of the second page of the IRP. It can be a long meeting. There's a lot of stresses already in the client's life. So, but now you all as advocates know that this great resource is there. Okay, so I'm going to wrap up this section with, well, actually, no, I lied. We still have a few more slides. I wanted to give some tips for working with WorkFirst, and this will hopefully answer the question that was asked earlier about, survivors of domestic violence. So first, one tip is read through, or encourage clients to read through their IRP thoroughly and make sure it's actually something that they can follow. And if not, don't sign it. Again, advocates, I'm like a broken record, advocates can attend WorkFirst meetings and can help advocate for a reasonable IRP for clients. And if a client is homeless, and if a client is unhoused, they don't necessarily have to engage in the job search if they are conducting activities identified in the IRP to find housing. And this is similar. If a client has health problems, they don't necessarily have to engage in that 12-week job search that I mentioned if they are conducting activities that are listed in their IRP to help with their current health issues. And there are other reasons why a person might not have to engage in the job search portion. So I included a link to the program rule that includes a full list, but I wanted to give a specific example. So if a client is home unhoused because they had to flee from a domestic violence situation, their IRP might just say that they need to meet with their DV advocate at the YWCA once every other week and meet with their housing stabilization case manager at Solid Ground once a month. And as long as they're doing those items, they won't have to do job search related activities like showing that they applied to 2 jobs a month or attend a resume writing class, whatever that might be. And these individuals are still part of WorkFirst, and so they can still access those WorkFirst systems. So this is a situation where if you're working with a client who is unhoused, they're not able to work because of health problems, they may be able to, but just not at the moment, or they are a survivor of domestic violence and they need to focus on other things first. This is a point of advocacy. Even if you have to take the rule with you into the meeting to show that, as long as the client is doing other activities in their IRP to help them get stabilized, they don't have to necessarily do the job search portion. And actually, oh yes, go ahead, sir. I was actually going to pass it off to you anyway, so go ahead.
One, as a caveat to the question around, if someone, is in a domestic violence situation or has been and is, does get an IRP that does not include WorkFirst activities, but includes, like Hannah said, meeting with a DV advocate, maybe meeting with a housing case manager. And those are the things that are in someone's IRP. You still want to make sure, if you're working with this client, that they are able to follow through on those activities. Because if they don't follow through on those activities, if they are required to meet with their DV advocate, but they don't really feel like that's helpful, so they stop meeting with their DV advocate, that can be a reason for sanction. And someone's benefits can be sanctioned for not participating with something like a DV advocate if that's actually what's in someone's IRP. So I think just make, again, as Hannah said, and, can't reiterate this enough, an IRP is a contract, which means that both sides have to agree, and clients, shouldn't agree to something that they don't think that they're going to be able to actually follow through on. And if they get in a situation where they think they're having difficulty following through for whatever reason, communication with their DSHS caseworker to revise the IRP is ideal before someone ends up in a sanction situation. And so same thing with folks that are unhoused. The goal of the IRP, as opposed to work requirements, can be activities related to establishing safe and stable housing. And again, these can be things like meeting with a housing case manager, meeting with different kinds of advocates, working on getting replacement IDs, birth certificates, counseling. It really can be anything. If someone is in a shelter program and there are different types of case managers that someone is meeting with, or different kinds of groups that people are attending, those can be activities in an IRP that are helping people, move towards getting housed. So I think really helping clients know, know what their options are outside of the actual work requirements. And I see a question, help getting a birth certificate. How can they get help getting a birth certificate? Hannah, do you have, definitely I have seen, like literally written into the IRP is part of someone's time towards IRP activities can be getting birth certificates. I would actually have to look up whether there is financial support for paying for the birth certificates. That I don't know off the top of my head.
Mm-hmm. One of the things I'll mention, the question was, how to get a birth certificate. One of the things we're going to talk about is accommodations for individuals. It's called an equal access plan. So if somebody needs additional assistance or kind of some special accommodations to be able to engage in this process, one of those line items is that their DSHS worker is supposed to help them get documents that they need to, sorry, I'm getting a call from the state, to engage in the program. So that might be an option. If someone has an equal access plan, they can actually ask their case manager for assistance in getting those documents. Any other questions that came through?
I guess one other thing I can add about birth certificates that just occurred to me, if DSHS is requiring any type of documentation, so if it's DSHS actually that's requiring the children's birth certificates, there is a rule that says that DSHS has to pay for any type of documentation that they are requiring that you have. So if by chance it's a DSHS requirement, then DSHS does have to pay for that documentation.
Okay, great. If there are no other questions, I'll move on to the next portion. And we'll definitely have hopefully time at the end for more questions. And then we'll also talk about our Ask a Lawyer program, which will give everyone here kind of more access to the attorneys. You can ask questions down the road. So this next section that we're going to talk about is the TANF and WorkFirst sanctions process. So what is a sanction? We've mentioned that a few times. It's a penalty, and it lowers the amount of the TANF grant that the family or the participant is going to get. So DSHS can sanction an individual or stop the TANF grant altogether if it decides that the individual failed or refused without good reason to do everything in their IRP or to meet some other WorkFirst requirement. And just so you know, if someone is in sanction, it shouldn't be affecting like their medical assistance that they're getting also through DSHS. Sometimes, this is something that I've noticed, a client may not realize they're in sanction status until their grant is reduced. And this might happen because they're not getting their mail or they changed their phone number. So they're missing letters or phone calls from DSHS. So as soon as a client realizes they're in sanction status, they can appeal. And we'll give some more specifics about that appeal process later on. And they can start working on fixing the sanction. But if they had a good reason for missing the notices about the sanction process or a good reason for not complying with the IRP, they might be able to get those benefits back, even if they're already in the sanction status. So a little bit more about the sanction process. So the actual reduction of benefit, it is either one person's share or 40%, whichever is more. And this is after you have not met your IRP or other requirement for 2 months in a row. If you are in sanctions for 12 months in a row, then the benefit may end, be terminated. And again, DSHS should let the participant fix or cure the sanction so that they can get out of sanction status. And DSHS is required to send letters and schedule meetings before you're actually in sanction status. And just a note, if the sanction is because the individual didn't follow the IRP, they will have to then follow the IRP for 4 weeks in a row or 28 calendar days to fix the sanction. So it might be that someone is in sanction for 1 month because it takes them 1 month to cure the sanction, but then they can get out of it. So I just wanted to give a little bit more detail about the actual process and moments for advocacy and where case managers can help, can be involved. So the first step is DSHS sends a letter that explains what the recipient failed to do and tells them how they can contact how they can contact DSHS within 10 days of that letter to explain, what happened, why they didn't comply. Then DSHS is going to schedule a meeting called a case staffing meeting. And at this meeting, DSHS talks with the client and tries to figure out if they had a good reason for not doing what they were supposed to do. At these meetings, DSHS is required to screen the client for family violence or other barriers and consider that in making a decision. And again, advocates can absolutely attend these meetings with clients as long as the client gives permission. They can bring an advocate or a case manager with them. After the case staffing meeting, DSHS will make a decision about whether there was, a good reason for not following the IRP. If there was a good reason, there are no sanction. If they find there is not a good reason, then they will move forward with the sanction. DSHS must send a letter at least 10 days before the sanction starts, again, to explain the process and includes information about how to appeal. And then after 10 days, DSHS will lower the grant. So why might somebody be sanctioned? An individual might be sanctioned, again, if DSHS decides that they failed or refused to do without good reason at least one of these things. This list isn't exhaustive, but it gives you an example. Either they didn't give the case manager information that was requested to make or update the IRP, they missed appointments in their IRP. This is what Sarah mentioned, if someone's working with a DV advocate, but that's not helpful, so they start missing those meetings, that might be a reason for sanction. If they didn't show that you're doing your best to do everything in your IRP, or if you do not or refuse to take a job that complies with labor laws and doesn't have unreasonable working conditions. So that would be if somebody was offered a job that they would otherwise have to take and they didn't take it. So what are good reasons? There might be, good reasons for not complying with the IRP or other requirements. The individual or family member might have a serious physical, mental, or emotional condition that interfered with their ability to follow the IRP. They may have been threatened with or subjected to family or domestic violence. If DSHS didn't send the individual a notice telling them what they needed to do or that they had an appointment that they missed, they can't sanction you if they never told you that you were supposed to do something. Or if there was a problem with affordable or appropriate childcare, or if transportation or childcare arrangements broke down, or something interrupted their ability to get childcare. If there was a legal problem, like they're dealing with an eviction notice, or, and I mentioned this earlier, if the individual should have been given an equal access plan, which we'll talk about a little bit more, but DSHS failed to screen this person, or they didn't follow that accommodation plan if an individual did have one in place. So, you can also be creative about, good reasons. It's basically something outside of the client's control that prevented them from complying with their IRP. And again, this is a good place for advocates to go with clients to these meetings and to help them, articulate what that good reason might have been. So I wanted to provide some tips to avoid sanction. One tip is to call the DSHS worker on the number. On the IRPs, it lists your case manager's name and phone number. So call them as soon as you know you aren't going to be able to comply with the IRP, or as soon as it happens. And again, you can explain, what happened and why it was beyond your control. You lost your childcare, or the car broke down. And if you can't get a hold of the caseworker, leave a detailed message and also keep a record of the date and time that you called. This is really important so that you or the client can prove later, if you need to down the road, that yes, they actually did contact DSHS as soon as possible. And again, just a reminder, DSHS will schedule meetings and they'll send letters before sanctions. So one thing I recommend is if you're working with a family that's receiving TANF or really any other DSHS or state benefit, help the client call or confirm with DSHS that DSHS has all the right contact information. Make sure the phone is updated, that they have the right mailing address. I see a lot of clients, the reason why they're in sanction status is because DSHS had an old mailing address or the phone number had changed. So they just were never even, they didn't know about what was going on. So that's a tip to kind of avoid sanctions, is try to make sure the state has all the correct contact information. One more slide here, and then I'll open it up for questions. This is just a note. There was this reset in the sanctions process in July 2021. So if someone's TANF was closed due to sanction before July 2021, and if they reapply, their case is going to open not in sanction status. But if TANF was closed due to sanction after July 1st, 2021, they must take part in the work activity, their IRP activity, for 4 weeks before they can get TANF again. And if the case was closed for another reason while you were in sanction status and then is reopened, you will still reopen at your reduced grant. So the sanction process changed last year. The rules were updated and changed. And so that's why there is this reset. So if you have a client that this might apply to, just some additional information about that reset. Are there any questions from the chat?
Yeah, one that I can't believe I missed this question before, because this is a great question. Are DSHS caseworkers required to review or assess support services a client might be eligible for, or is this the responsibility of the client?
No, it should be part of that comprehensive evaluation that I mentioned. It's that evaluation that's done in order to do the IRP. And that is supposed to be, the client, what the client should do, but also what DSHS needs to provide to support the client. So that includes support services. So if that's not happening, or if the client doesn't remember or isn't getting any of those support services, that would be a really good time to help the client contact DSHS and update the IRP to be explicit about the services. And Sarah, if you have anything else to add, please do.
No, I completely agree. And if there is a support service that somebody needed to be able to participate, and they didn't get, ultimately, if someone ends up in sanction, that could be considered good cause. If they weren't offered childcare or help with some other thing that would have made participating in their IRP more reasonable. There's another question. Actually, this is asked a couple of times. A couple of people have this question. My understanding is that once a client is in sanction, that is considered a legal process, and advocacy should be through legal services rather than case managers or other advocates. Is this true?
So if I understand the question, is this as soon as there is a sanction,
it sounds like they're asking, if
referred.
Once there's a sanction, is it then a legal process?
Their clients, as soon as there's a sanction or there's any kind of adverse action that the department does, the client has hearing rights. which is a legal right, that they have a right to appeal, they have a right to a hearing. And I would say, when you know the client's in sanction, or as soon as that happens, have them, contact our office, or if they're in another county, we can provide, the phone numbers for other legal services. You don't have to have an attorney to go through the process. Case managers and advocates, even at a hearing, these administrative hearings are supposed to be kind of more informal than maybe a civil or criminal court. So you can have an advocate help you at the hearing. So you don't need a lawyer, but I would recommend reaching out, trying to, if they can get legal services, that's a great option, but they don't necessarily have to have a lawyer. If a case manager feels comfortable advocating for the client or consulting with an attorney to then advocate with the client. I don't know, Sarah, if you have any other, or you disagree and think they should get a lawyer right away.
No, I mean, I think that, we are very fortunate here in King County that Solid Grounds Benefits Legal Assistance is available, and generally has the ability to either consult or represent pretty much anyone that makes contact with the office. And I say that as the person that used to manage that program. I don't anymore. So obviously I can't guarantee, that they're always going to be open. But generally speaking, the program usually has the capacity to, if not do full representation, to give advice and some self-help to a client. Also, we will be sharing at towards the end of this presentation both the contact information for benefits legal assistance, but something that we're offering as part of this training, which is our Ask a Lawyer online resource, where you can ask one of the lawyers from the benefits legal assistance particular legal questions around benefits. So because we have this resource, I say, absolutely, folks should be taking advantage of it. Is it absolutely necessary in every situation? Probably not, but it's always best to, connect your clients with the resources that are available.
Any other questions?
I didn't see any other questions in the chat.
Okay, great. So we are, I'm moving into other programs that TANF recipients may be eligible for. And a really important and really valuable program is the Working Connections Child Care Program. So this program helps families with children pay for childcare. It's a subsidy, a childcare subsidy, and it's paid directly to the provider. And the provider can be a facility like a kindercare or daycare provider, or it could be, if it's a family member or a neighbor who's providing childcare. So the child must be either a citizen or a legal resident. Again, the parent doesn't necessarily have to be, but the child does. And there's two different types of, or I should say there's two different avenues to access this subsidy program. If you are a WorkFirst family engaged in your WorkFirst activities, again, it can be something other than employment. If you're doing, school or job training, you can get a referral to this childcare subsidy. Or if it is a working family that's not getting TANF, but their income is at or below 60% of the state median income when they apply, or 65% when they're reapplying, they can access this program, even if they're not on TANF. And just so you get an idea of what the numbers are, that 60% of state median income for a family of four is $5,354. I realize I should have included a link, but on the Working Connections Childcare Program website, there is a chart, so it will tell you, the numbers, the percentage numbers, depending on the family. And the income will impact the amount that the copay that's provided or that the family has to pay. So it can be as low as $0 a month or up to $215 a month. Another upcoming program is there is a diaper subsidy. This is starting November 2023. So any families on TANF that have children 3 and under, they will get an additional $100 a month as a cash increase. You don't have to apply for it. I believe it will be automatic if the child is under 3. So that's something that's coming down next year. And there are some emergency cash assistant programs for TANF families or families that would otherwise be eligible for TANF but aren't receiving it for some reason. So one is the Errand program, Additional Requirements for Emergent Needs. So this is if a family has, an emergency or an urgent need to get or keep housing or utilities, and they have a good reason for the need, like they lost their job or there was a medical emergency. So there's a reason why they are in this emergency situation. So the maximum benefit is $750 in a 12-month period, but there are cases where families can receive more if it's related to health or safety. So, $750, especially if you live in King County and you're behind on rent, that's, maybe very likely not going to cover your rent. So individuals can ask for, it's called an exception to the rule. It's basically saying, yes, that's the rule, but here's the reason why I need an exception. And if it's related to health and safety. So, for example, if there is a parent whose child is on a ventilator and they need a phone to be able to contact the ambulance, or they need to keep their electricity on, and that's going to be more than $750, or they already used their $750 and they need it again. Or if there is, a domestic violence survivor who needs to leave an abusive situation, or they need to be able to pay their phone bill to be able to get, access to assistance if they need it. Those are just some examples of related to health and safety and for reasons why someone might be able to get more than just that $750 in a 12-month period. There's also something called Diversion Cash. This is for families who have a short-term need, but they don't want to get on TANF for, whatever reason that might be. The maximum benefit is $1,250. And if they do end up going on TANF within 1 year, they do have to repay a portion of the grant. And then lastly, there's the CEAP, or Consolidated Emergency Assistance Program. So this is a cash assistance program available to families or pregnant individuals who have an emergency and they don't have enough money to meet their basic needs. And so this can be families who their TANF assistance has been terminated in Sanction, or maybe who have already met their 60 months and they don't qualify for one of those extensions. So this is a good program for families that really have no other options for cash assistance. And the assistance is limited to no more than 30 days within a period of 12 consecutive months. So those are just some additional programs that clients may be eligible for. I'm going to switch gears a little bit and just talk about the reporting requirement for TANF and WorkFirst. And just kind of a tip to keep track or keep a record of your own reporting, because if someone doesn't report information, or DSHS says somebody didn't report information, their benefits could be terminated, or they might get an overpayment, which is when DSHS is saying you need to pay us back the benefits that they gave you. We'll talk about appeals shortly, I promise, but just some information about reporting. First of all, the approval letter, we always tell clients to keep those letters or to refer back to them, because it will tell you exactly what needs to be reported and also how to report it. But just some examples: if somebody if you move or someone, including the child, moves out of your home, if your gross monthly income goes above the payment standard, if your resources go above that $6,000 limit, or if you have a change in your employment or approved work activity. You can report this by calling the 1-800 customer service number. You can go into the office. What I will say is those phone calls to DSHS are recorded, whereas, if you go into the office, they do make a note, but if you have a recorded version, then that can be really helpful if down the road, DSHS says maybe you didn't report, but you have a phone recording showing that you did. When to report, also some important information. So changes have to be reported by the 10th day of the month following the change happened. So if you get a new job on August 1st, you have to have reported it to DSHS by September 10th, so the 10th day of the month following the report changes. And for changes in income, the date that the change happened is actually when you received the income. So let's say you started a new job, July 31st, but you didn't get your first paycheck until August 5th, you'd have to report it by the 10th day of September. And so for houses with TANF or state family assistance, another thing you have to report is if the child that's getting the grant, if they are going to be gone from your home for more than 180 days, so essentially if they've moved out and they won't be back within 180 days, you have to report it to DSHS within 5 calendar days of when you learn that the child won't be returning home. Now, if the child is temporarily gone for less than 180 days, the parent can still keep their grant for the parent and the child. I want to just unpack this a little bit and give some more examples about the temporary absence. So the rules are different if child welfare is involved in the reason why the child is out of the home. So for example, if we have a parent and their child, if the parent reports to DSHS that the child is going to stay with the grandmother for 2 months while parent looks for stable housing, the parent can keep receiving her TANF because the child is temporarily out of the home. The grandmother that's watching the child will not be eligible to get a TANF grant because there wasn't child welfare involvement. But if it's a similar fact pattern, but there is child welfare involvement, then both households might be able to receive the grant. So again, if the child is removed from the home, the parent, but it is going to be back within 180 days, the parent can keep getting their parent and child grant, but the grandmother can now also apply for a child-only grant because child welfare was involved. And if the grandmother is also income and resource eligible for TANF, they can actually apply for a child and TANF grant as well. So those are called concurrent benefits. And there also are some other some other differences if the absence is because the parent is entering a hospital or a treatment facility. So if you have a specific example, you can contact us through the Ask a Lawyer program or put a question in the chat. But I just wanted to flag that since that might be something that clients or advocates see. Okay, so just some tips and tricks about how to avoid problems and benefit pitfalls. We've already talked about the reporting requirements, but I just wanted to provide some kind of real life examples of what we see and solutions that we help clients with. So for example, reporting changes timely is really important. We worked with a client who got an overpayment because DSHS said they were getting unemployment and TANF at the same time. They were over the income limit. And they did report when they started getting unemployment benefits, but the unemployment system showed that they actually got it a couple months earlier, which was inaccurate. So we were able to use the client's bank statements to show that they actually did report timely and the overpayment was dismissed. But on the other hand, we worked with a client who did receive TANF and unemployment and did not report it at all. And so there was an overpayment that we weren't able to overcome or get dismissed. Another way to avoid easy benefit pitfalls is, complying with the IRP or letting DSHS know as soon as you know that you aren't going to be able to comply. We worked with a client who, in her IRP, was required to work with a DV advocate once a month. They had to leave the state for a family emergency and ended up missing those meetings. But as soon as the individual got back into town, they started working again with their advocate. They followed it, for those 4 weeks. So their sanction should have been fixed, but they actually were still in sanction status. So we helped the client show to DSHS that while they were, they had been in sanction that 1 month, they had actually cured it in time. They complied with the program requirements, and the client was able to get their full benefit and the amount that they had been missing the prior months. So those are just some kind of real life examples of what it looks like to report changes and comply with the program requirements. All right, how to avoid pitfalls continued. I've mentioned this already a few times, but there is something called an equal access plan. So DSHS must provide, it's also called necessary supplemental accommodation, to all individuals with a mental, neurological, physical, or sensory impairment or other limitation that prevents them from accessing or maintaining benefits in the same way that an unimpaired person would. And the reason why I just read that to you all instead of summarizing is because DSHS should and has the obligation to screen individuals as they work with them and determine if they should get an equal access plan. But clients can also ask for one. And this is another good advocacy. If you're working with a client that maybe is in sanction or their benefits are turning off and on because they, you and the client identify there's a barrier to being able to engage in this program, that would be a really good time to ask for an equal access plan. And the services that can include is DSHS will provide help in filling out forms or getting information. They can get more time to fill out paperwork. They can get forms in accessible format, like large print. They can get assistance with requests for fair hearings. They can get a quiet space in the office to fill out questionnaires. They can get a phone call in addition to a letter. So there's kind of a whole list of things that can be an equal access plan. And then another option is that the client can designate an authorized representative. So this is someone who can talk to DSHS on behalf of the client. It can be an individual or an organization who can talk to DSHS and act on behalf of the client. And an important part of the AREP, the authorized representative, is that they can get copies of all DSHS notices. So if there's a client that, just is not able to get their mail timely, or they don't have a mailing address, or it's really far away, but if you can sign up as an authorized representative, you can just ask to get copies of notices so that the client isn't missing deadlines or reviews. So that's something that we sometimes do for clients. Okay, we will have a break shortly for more questions, but first I just want to talk about, what if something goes wrong? And we've talked about the appeals process, and we've arrived at that part of the presentation. So if somebody's benefits are denied, reduced, terminated, there's sanctions, there's an overpayment, basically if anything that negatively impacts the client's benefits, the client has the right to appeal that decision. And in order to appeal, the client asks for a hearing. And that's how you appeal. You ask for a hearing. And these are called administrative hearings. And it's basically when a judge looks over the case to see if DSHS did anything wrong. And the client can also, present their own evidence or witnesses and, explain why they disagree with the decision. So again, a hearing, we as lawyers kind of throw around these terms a lot, but what a hearing is it's a request for someone other than DSHS to look at the case and see if there was a mistake. So again, benefits denied, reduced, terminated, you can request a hearing. And how to request a hearing, you can call or write to DSHS. So you can call the customer service number, you can go into the office, or you can contact the Office of Hearing Administration directly. You have the right to be represented by an attorney or to have an advocate with you. I included the phone number for the DSHS customer service and then also the Office of Hearing Administration. And I want to stress there's no magic word. The client doesn't actually have to say, I want a hearing. They just have to express disagreement. So as long as they say, I don't agree, or question why they got this decision, DSHS is supposed to understand that that's a hearing request and process a hearing. It doesn't always happen. Sometimes it's not clear that the client's requesting a hearing, or DSHS doesn't understand that to be what's happening. So if you as an advocate can help the client request hearing, that can be really helpful, or you can refer the client to us for assistance with that. So some important deadlines for requesting a hearing. They have to request a hearing within 90 days of the date of the termination, denial, sanction. Basically it's within 10 days. If a client wants continuing benefits, they have to request the hearing within 10 days. So if there is a notice that they're going to be sanctioned, but the client disagrees, if they request a hearing, then the sanction won't happen until there's been a hearing decision. But if it's a different type of cash benefit, or something other than a sanction, if you ask for it within 10 days, you can get those continuing benefits. And just to know, if the client does lose at the hearing, they may have to repay up to 2 months of those continuing benefits. So that's something we just always talk to clients about so that they know there is that possibility. Okay, so that is a little bit about the hearings process. I will wrap up with some information about the Ask a Lawyer and Referrals, and then we can open it back up to questions. So as Sarah mentioned, part of this training series is that we've also started this Ask a Lawyer program. So we have an email address, benefitslegalhelp@solid-ground.org. You can email questions or real-life client scenarios. So if you have a question about the application process, eligibility, qualifying for an exemption, if someone is in sanction status and needs help, if you have questions about support services, and not just for TANF, if there are questions about food assistance or ABD or HEN or Medicaid, you can ask us those questions. We just ask that you put Ask a Lawyer in the subject line, and then one of our attorneys on our program will respond. And I just want to really plug this. I know sometimes people think like, oh, sure, the attorney says contact me, but they're so busy. Are they really going to respond? And the answer is yes, we really will respond. And, it's actually almost more helpful for us, because if we're able to help clients get ahead of legal issues, they may not even need a lawyer in anyways. So just again, benefitslegalhelp@solid-ground.org. And then if you want to make a direct referral to our program, I'll leave this slide up while we answer questions, but there's our intake number. Our intake email is actually the same as the Ask a Lawyer. And then on the right are our team members and all of our contact information. So that concludes everything that I wanted to talk about. I'll see if there are any additional questions.
Sorry, I lost my mute button for a minute. Yeah, there were a couple of questions in the chat. The first one, back to childcare. If it's a 2-parent household, but only one parent is working, can they still get childcare assistance?
Okay, that's a good question. There is probably going to be some additional verification that needs to be provided to DSHS about. So one thing that they're going to ask is, well, if the other parent isn't working, why can't they provide childcare? That's kind of the question that has to be answered. So yes, the answer is yes. If the other parent is working, they may still be eligible for childcare, but they're going to have to explain why the other parent is not available to provide childcare. So that might be, the other parent has a disability and the child is a toddler. So, they just physically aren't able to run after a toddler. Or, the other parent maybe is in a treatment program. So they're going to be busy doing that, or counseling sessions. So they're not available to care for the child. So short answer is yes, but you're probably going to have to provide some additional verification. And Sarah, if you have anything you want to add to that.
No. So another question is, if there is a 2-parent household and DSHS says they only need to complete applications for paid family medical leave and unemployment, and the family completed those tasks, but DSHS still denies their TANF application, what should they do?
I'm wondering if in that scenario, if they were approved for those programs, if the family gets those other assistance and they're over the income limit for TANF, there may not be a way that they qualify for TANF if their income, it puts them over the income limit. If there's another reason why they're denied, whoever asked the question, I'd encourage you to email us directly, because I have follow-up questions about, why else they got denied. But if it's because they were over the income limit, then that just might be that they're over the income limit and not eligible for TANF.
Says no other apps are still pending. It sounds like I would probably want to see the reason for the denial on the denial letter.
Absolutely.
Yeah.
And that's usually just so folks know, if they're referring a case to us and you as the advocate, if you can, with the referral, provide a consent form that's signed by the client, that just puts us ahead of the game. So if you have a copy of the denial notice and you want to send us a copy, so we don't have to burden the client with that or get a copy from DSHS, it just makes things, quicker. So I just encourage that if you have those documents, share it with us when you reach out, as long as the client's okay with that.
Yeah. Will the Solid Ground Benefits legal team be able to advise clients on if they're likely eligible for Errand or diversion grants? Also, do those application processes move pretty quickly so that funds can be applied to emergency situations?
Yeah, so for the first part of the question, if there are questions about eligibility, we can absolutely provide, advice and counsel. We offer a variety of levels of representation. So if a client doesn't have a hearing or doesn't need a, full-blown case, they just have questions about eligibility, they can absolutely contact us. I also mentioned there is on WashingtonConnections.org this See If I Qualify kind of quiz or questionnaire. So if for some reason you're not able to get a hold of us, the client can go through that to see what they're eligible for. Okay, so as far as Errand, in theory, it is supposed to move quickly because it's emergent. If DSHS is waiting for documents or verification of certain documents, it can take longer. So I've had cases where, we needed to get something from the landlord to be able to get a ledger to show that they're behind on rent, or you have to, for Errand, you have to explain why you don't have the funds, or that you have a plan going forward for paying for your rent. So sometimes you have to get an agreement from the landlord that they'll accept a lower amount or put you on a payment plan. So, I've seen Errand cases take a couple weeks because of needing that additional verification. So it's just, if there's anything that you can do to get things ready before the application. And I'm sorry, I actually already forgot the second part of the question.
Oh, does the process move quickly for an emergent need?
And that's been my experience, that it, doesn't move as quickly as we would hope it would. But I don't know, Sarah, if you have, maybe I've just had those tougher cases and it does move quickly. If you have anything to add.
I think it just depends. I mean, if DSHS has everything that they need, it can move quickly. I think really like to what you said, it's if they're waiting on additional information. If it's denied and the client wants to appeal, that's where things don't usually move very quickly. That can be a challenge. And I think the biggest thing that I always saw was the ability to pay, someone being able to show that they have the ability to pay their rent going forward. That can be a tough, if someone is paying something closer to market rate rather than a deeply subsidized rental amount. Any other questions? Folks can feel free to either put them in the chat, or if you want to come off mute, we're happy to take more questions.
I'll go back to the Ask a Lawyer slide just so you see that.
We also put links in the chat for the survey for this training. If you could fill that out, that would be extremely helpful for when we do this training again in a few months. And also a link for the registration for our training in July on Medicaid. All of your questions were answered.
Or again, I'll plug the Ask a Lawyer.
Yeah.
You know, asking a question in this type of platform isn't your thing, please definitely do email or give us a call.
For sure.
Okay,
well, thank you.
Stop sharing my screen.
Yes, Allison, happy to have you share.
Thank you so much, Hannah and Sarah, and all the folks who are still on the call and who've participated in this. I just thought that as I was listening to this, as a person who has not done direct client services work for a long time, but did once upon a time, I couldn't help but think about how remarkably complex this is. And that's not even layering on the experiences of homelessness, housing instability, family violence, and other issues that folks are grappling with. And since there is time, I just thought that it might be useful for those who are still here, which is over 50 people, to say the reason that the coalition and the benefits legal assistance folks and our third partner, the REACH team, actually have the support to develop and present this series of public benefits or key trainings is in fact because of the work that all of you do and the ways in which you have shared your experiences as service providers, advocates, and in some cases, service recipients, and brought your experience of navigating DSHS's programs to the coalition. And that's very special. As we were putting together the proposal for the public benefits or key program, I actually had to do a little poking around to see, well, is anybody else doing this work? And as far as we can tell, the answer in the entire state of Washington is no, nobody else is doing this work. That's not because it's not necessary. We all know this work is challenging. The pandemic has made it more so. You, coalition members, service providers, frontline folks brought us the information about the incredibly negative impacts of DSHS closing the community service offices on your ability to get people the programs and services that they need. And I hope that you all will consider this space in these trainings as another opportunity for you to bring forward what it feels like and is like for you and the folks you work with to attempt to navigate services. I'm not saying that we can fix everything that's wrong in these systems, but what I'm saying is there is remarkable power, not only in getting the kind of detailed, up-to-date information that Hannah and Sarah have shared today, but also in keeping the conversation going. So we really invite you to consider this an ongoing dialogue. You may leave here and say, that was so much, I need to go back and look at the slides and absorb it. Totally fair. Share with your colleagues. The recording will be made available to you. But we also really want you to contact Hannah and her team, to contact Sarah and Jody and our team, and to bring your stories forward, because the way that we get change, and indeed the way that we got the CSO offices reopened after almost 2 years of being closed to our folks in a pandemic, is because we hear what's happening on the ground from you. We look for patterns and we bring that to the highest level officials there are. So I really just want to, really encourage you. This Coalition on Homelessness is not, we are not a government agency. We are not a bureaucracy. We are an unusual intermediary organization that does policy work and advocacy that's informed by your experiences. And there's a lot of power in that, and we recognize you're probably exhausted, as are the folks you are working with and trying to serve. So we don't want it to feel like one more thing, but we want you to consider these are opening lines of communication. And if something occurs to you 3 weeks or 3 months from now, we want to hear from you. I have the luxury of being able to say that because I'm not immersed in the day-to-day that you all are, but I want you to know how much we value it. And it has led to changes in the legislature, and we have the ears of lawmakers and people in DSHS, and we intend to use that. Thanks.
Great, thanks everybody. We will, if anyone has more questions, we will stay on for a little bit. Also, if you have questions about our next training around Medicaid, especially if there are particular things that you are interested in learning, we're still developing that particular curriculum, and we're happy to incorporate some of your questions and ideas into that next training. And just really appreciate all of you being here. Feel free to reach out to ask a lawyer. Feel free to reach out to me with ideas for public benefits trainings or any systemic issues that you are seeing in our state public benefits system, as Allison said. And look forward to working with all of you. Thanks.